Crisis Prevention and Intervention in Healthcare. 1.0 Introduction. The management of assaultive behavior is intended to provide protection for the client and healthcare professional against any type of assault from either party. Assaultive behavior in the healthcare setting compromises the safety of the healthcare workers, the patients and visitors to the emergency rooms, mental health units, group homes, long-term care facilities, etc. The abusive behavior undermines the efforts of the healthcare professionals that are in many cases the victims. Poor behavior management costs the hospital time, money and high turnover rates. This chapter will discuss the meaning of assaultive behavior and crisis, as well as discuss the types and causes of crisis. 2.1 Definitions. The meaning of crisis can be expanded by defining crisis, assaultive behavior and violence. According to Aguilera, 1998, p. 12, crisis occurs when a person is unable to deal with problems that seem not to have a way out. The unresolved problems give way to anger, emotional unrest, tension, anxiety and stagnation. Crisis is viewed as a psychological instability that results from extreme situation or condition where the resolution is not attainable by means of common remedies. Crisis can also be used to define a situation where assaultive behavior or violence has occurred. Great emphasis is placed on ensuring that strategies are employed as early as possible in the process to detect potential situations early, prevent escalation of emotions that could result in assaultive behavior and effectively manage the crisis situation if it occurs. Crisis is used to refer to assaultive behavior when it is extremely negative, unpredictable, uncontrollable and unacceptable in the society. 2.2 Background of crisis. Assaultive behavior can occur anywhere in the hospital or other healthcare settings are not exceptions. People without any history of assaultive behavior or psychiatric condition can suddenly become combative. Assaultive behavior can be as a result of medical conditions or illnesses as well as certain medications. Assaultive behavior is present in people of all cultures and socio-economic status. Crisis may also be as a result of unresolved emotional issues. People experiencing crisis desire to solve the problem as quickly as possible. They are influenced by actions or words from others, because they crave for a solution that can change their situation. Assaultive behavior may be directed to relatives or family members, neighbors, roommates, authority figures, men, women, medical professionals, peers, bystanders, and passive peers. The assault can be done in the home, care facility, homeless shelter, hospital, school or correctional institutions. The common assaults involve the use of a 1. Weapon, 2. Physical violence and 3. Throwing of objects. The medical conditions that have been found capable of leading to assaultive behavior include 1. Vascular dementia, 2. Alzheimer's, 3. Diabetes, 4. Stroke, 5. Delirium, 6. Excessive alcohol and 7. Medicine intoxication. Features of crisis. Crisis that involves assaultive behavior or violence poses a threat. The crisis reveals a persistent inability to change condition or eliminate the effects of the underlying issues. Crisis invites tension, confusion and fear. The person in crisis experiences a lot of discomfort. The person in crisis remains in a disequilibrium state. Crisis can be said to be forthcoming if the client has a record of violent behavior and tendencies of verbal abuse towards others. 2.3 Examples of crisis. Crisis occurs when a person is physically sick or a close person is sick. Other examples of crisis include divorce or separation, loss of a person through death, accident, natural calamity, financial constraints, unwanted pregnancy and unemployment. If there is no intervention to the underlying situation, it may lead to trauma. 2.4 Corresponding factors of assaultive behavior/crisis. In an attempt to understand the meaning of crisis, Aguilera, 1998, p. 13. Discuss 3 corresponding factors that a person with assaultive behavior experiences. The corresponding factors involves perception, support, survival. Perception deals with the attitude and view the person with assaultive behavior has towards the underlying problem. The underlying problem could be finances, health, reputation, work, education and career, which are very important to the person. In a mental health patient, the individual has the paranoia that the nurses have bad plans against him. That is why, when there are a group of people around them, they need proper explanation as to why they are in the midst of a crowd. If a good explanation is not proffered and on time, they may perceive themselves as trapped and start violent actions like attacking anybody in the group or throwing objects. Healthcare professionals must remember that mental health patients have auditory hallucinations which they feel compelled to obey. 3.0 Types of crisis and their causes, according to Colling and York, 2010. p. 484, crisis can be distinguished according to the person who performs the assault and event. The 4 types of crisis include: 1. Criminal, 2. Patient, 3. Worker and 4. Domestic. 3.1 Criminal crisis, assaultive behavior. The individual performing the assault may not be related to the healthcare institution or the patient. This can be a criminal who finds his way into the healthcare facility. They may rob or steal items belonging to patients, visitors or the healthcare facility. Criminal crisis happens because of availability of weapons such as guns. When the hospital security is weak, the criminals may find the hospital accessible and commit crimes. The hospital may lack movement restrictions within the medical facility. Because of the existence of safes in the hospital where patients' money, jewelry and other valuable items are stored, it could become a target for robbery. Some criminals choose to abduct patients receiving treatment and become violent when committing the act. Criminals causing problems in healthcare facilities consist of terrorists and unwanted visitors. The criminals may pose as legitimate visitors to the patient or as healthcare workers. Salmon and Varela, 2007, p. 4. 3.2 Patient crisis. The patient receiving healthcare service can become aggressive. Patient crisis is caused by patients who are receiving treatment. Some of the patients may be mentally disturbed and cause harm to others. Some patients who are mentally ill, abuse drugs, are traumatized or are frustrated by the situations, hence they become aggressive. The patient may take advantage of a situation where the healthcare worker is alone in the healthcare facility, possibly performing a medical examination in an isolated room without the company of another person. They may use their nails, fists, body fluids, feet, teeth, food utensils, head, furniture or medical equipment to inflict injury on the healthcare professional. Charney and Fragala, 2000, p. 163. 3.3 Worker crisis. Worker crisis involves a healthcare professional of the healthcare facility. The aggression may be directed towards another worker, patient or a visitor. Healthcare workers may have underlying disputes with each other that could result in aggressiveness. Depending on the nature of their dispute and anger management, the unresolved conflict may result in violence. The employees may work within the same department and rank at the same level. The common forms of abuse can be overt or covert. Overt abuse can be in the form of verbal abuse. Covert abuse takes the form of psychological harassment. The uncomfortable situation may be motivated by the workers withholding information from each other, change of duties without consenting and informing the other, criticism, isolation and refusing to assist at work. Richter and Whittington, 2006, p. 3. A typical example is a nurse who always comes late. Everybody on the unit knows that if they are assigned to relieve someone, the outgoing nurse would never leave on time. Such behaviors can result in unpleasant open confrontations and arguments on the medical unit. Lenza, 2006, p. 86, adds that, the healthcare provider may experience stress because of understaffing and workload. 3.4 Domestic crisis. Domestic violence can be said to occur in the healthcare institution where the patient, the healthcare worker, relatives and friends to the patient engage in assaultive behavior. The relatives and friend to the patient may become impatient if the hospital takes long to attend to the patient, delays treatment or medical procedures. On another note, the relatives or friends may have personal differences with the patient and resolve them in the hospital. An example could be an abusive husband whom the wife is hospitalized as a result of his actions. He then meets face-to-face with the mother of the victim at the bedside. Also, the patient's relatives could become assaultive because of experiencing stress that comes with the patient illness. An argument can quickly escalate into a fight because of financial, emotional and excessive anger that either the patient or their visitor may be experiencing. 3.5 Verbal and physical abuse. Physical abuse is directed to others, self and objects. The patient, healthcare worker, visitor or criminal may become violent to another person and beat, bite, slap, hit or push them. The patient can hurt self by biting, cutting and inflicting injury on the body. In some cases, a patient, visitor, healthcare worker or criminal may throw objects towards another out of anger. Whether verbally or physically assaultive, a patient can become uncomfortable in their environment and become irritable, as Duxbury and Whittington, 2005, p. 472, discuss. A restrictive environment can become a source of conflict. Crisis can be caused by internal, external or interactional factors. The patient may have mental illness or be under the influence of medication that can cause aggression. The healthcare worker or the patient's visitor may also have internal perception of the issues concerned and become violent. Internal aspects of crisis involve thought disorders, alcohol abuse and substance abuse. 4.0 Conclusion. Types of crisis/assaultive behavior include criminal, patient, worker and domestic crisis. People with crisis engage in physical and verbal abuse. Crisis is triggered by internal, external and situational factors. Medication, illness, substance abuse, lack of training for workers, unresolved emotional issues, lack of communication, long waiting time, delayed or denied services and poor security could lead to assaultive behavior. Crisis refers to assaultive behavior or violence that occurs after an individual is unable to change uncomfortable circumstances, becomes unpredictable, unmanageable and their behavior is not approved in the society. Crisis occurs when an individual cannot change circumstances and the available resources are limited.